Good morning. My name is Joanna Martinez. I am a certified diabetic educator. I assess patients with their knowledge about their illness, their willingness to learn, and where the patient educational needs lie. To be successful in the field, you have to be a people person, have outstanding communication skills, but most importantly, have sensitivity to cultural differences. Every day you will meet different people because their illness is very common and can get any group. Go.
Ms. Martinez, you have an appointment with the newly diagnosed patient, Mr. Bradley Rabowski. He'll be in shortly, but here are his papers.
Okay.
Oh. Hi, are you Mr. Rabowski? Nice to meet you. Please have a seat. So, Bradley, what has brought you here today?
Go.
Good afternoon to you too, Miss Martinez. I've recently been diagnosed with type 1 diabetes and I'm looking for ways to better deal with it at home.
Well, Bradley, type 1 diabetes is a chronic condition in which the pancreas produces little to no insulin, yes? There are so many symptoms you should know before we talk about ways to deal with your illness. These symptoms may include hunger, fatigue, urinating more often, increased thirst, dry mouth, itchy skin, and occasional blurred vision. However, these symptoms are nothing to be afraid of. There are many medications and solutions to help you have a normal and comfortable life.
Is it true that my diabetes is an insulin-dependent diabetes?
Yes, type 1 diabetes is insulin dependent. You will need insulin in form of injection or through the use of continuous pump. Learning to give injections to yourself may at first seem the most dangerous part of managing diabetes, but it is so much easier than you think. Some people with diabetes use a computerized pump called an insulin pump that gives insulin at set bases. You and your doctor can program the pump to deliver a certain amount of insulin throughout the day, the basal dose. Plus, you can program the pump to deliver a certain amount of insulin based on your blood sugar level before you eat. Today we will create a healthy meal plan for you, one that requires a small amount of carbs because the higher amount of carbs you eat, the higher doses of insulin you need.
I see. I'm interested in my options for meals, so let's get on it.
Nutrition is an important piece of living with diabetes and keeping yourself healthy. Understanding how different foods affect your blood glucose and learning to develop a good meal plan will be an important part of your daily routine. Eating includes a wide variety of foods including vegetables, whole grains, fruits, non-fat dairy products, beans, poultry, lean meats, and fish.
Interesting. Are occasional sweets an option?
It takes some planning, but you can fit your favorite foods into your meal plan, including sweets, and still manage your blood glucose, blood pressure, and cholesterol. So all you need to do is limit your sugar intake and eat treats in moderation.
Alright, that sounds reasonable. Oh, sorry.
Your meal plan is now complete and fitted to your specific needs. Any more questions?
Yes, actually. I found what you do as a certified diabetic educator to be very interesting, and I was wondering if I could train to be a CDE like you to help people like myself.
Well, to be a CDE, one must get the proper education to get a certification. In terms of education, you must have 4 years of health-related education in a college or university.
I've learned a lot today, and when I get home, I'm going to research more about my condition and CDEs. Thank you so much for your advice and guidance. I've truly learned a lot today.
Here is your paperwork, and I'll lead you to the door. It was nice meeting you.